making sure it's playing and set it up.
Hi, so I'm Shannon Tobin.
And I'm Paige Wesolowski.
And we're going to be talking about the consequences of sun exposure.
So basically, as a little introduction on what we're going to talk about in this presentation is, first of all, UV rays. So we're going to talk about different types of UV rays and the types of UV rays that actually affect you and actually affect your skin, and then those specific reasons why those do. We're going to address vitamin D, which is a huge component of this presentation because the sun gives you vitamin D that you need for your body, and that's where a lot of the benefits come from. And then also some of the chronic sun exposure benefits, stuff like seasonal depression, type 2 diabetes, and actually hypertension, like lowering of hypertension, all come from chronic sun exposure, as we're going to touch on later. Also disadvantages, as I'm sure you can assume, skin cancer, sunburn, skin damage, wrinkling, things like that. And then also touch a little bit on prevention and treatment of those things.
So the first part we're going to talk about is UV rays. So there's three major wavelengths, which are visible light, UVR, and infrared radiation. So there are three categories of UVR, which are UVA, which is 315 to 400 nanometers, UVB, which is 280 to 315 nanometers, and UVC, which is 180 to 280 nanometers. UVA, which goes to the dermis of the skin where the light is absorbed. So this is the one that goes the deepest into your skin, is the most affected, as you can see on this picture specifically. And the second is the UVB, which penetrates the superficial skin, and you can see also on this picture that the UVC doesn't even reach through the ozone layer completely. So the one that's mostly affected is the UVA, which leads to skin aging and wrinkling, and UVB and UVA both combine to affect skin cancer as well.
Something interesting about this is that actually only 95% of the sun rays, or 95% of the sun rays are blocked by the atmosphere, so only 5% is actually getting through and affecting your body. So it's interesting to think about how a little percentage can do a lot of harm and also a lot of good to your body. So I want to touch a little bit on vitamin D and how that works. So basically, UVB radiation is what's going to be the big component here on how vitamin D is made in your body, and there's a couple different steps that go along with it. So first of all, UVB radiation is going to interact with the 7-dehydrocholesterol that's in the subcutaneous layer of your skin. So this is the very first step. That's going to interact with that, which actually turns it into the vitamin D3. So this is going to bind with a free vitamin D binding protein, and it's going to be carried to your blood through the bloodstream into the liver. So the liver is where the first process is. So this is going to metabolize this product and make it into the 25-hydrodioxo vitamin D. So this is the inactive form. This isn't like the biology active form that's going to affect your body, but this is actually the part that's measured. If they're looking at levels of vitamin D in your body, this is the substance that is measured. So then from here, it's going to go through your bloodstream again into your kidneys. So this is where the biologically active form is made. This is the 1,2,5-dihydroxy vitamin D. So as you can see in this little diagram over here, it's a little easier to see the sunlight. It goes into your skin. It's going to interact with the 7-dehydrocholesterol, which is making the vitamin D3 going to the liver. Also here you can note that you can also get vitamin D through your diet and things like such as fish and mushrooms. And that's also going to go to the liver, which is going to make the 25-hydroxy vitamin D3 go into the kidneys, which makes the biologically active form, and that's where you're going to see all the positive effects.
So next we're going to talk about is the benefits of vitamin D, so bone health and how it promotes bone formation, and hypertension, diabetes, specifically type 2, cognitive function, and cancer prevention. So the first part we're going to talk about is bone health. So the indirect effects of vitamin D specifically are to promote the absorption of calcium, magnesium, and phosphate in the intestines and in the renal system. So the direct effects are on the osteoblasts specifically, which are the bone-forming cells. So basically it targets bone formation with the 1-alpha 25 dihydroxy vitamin D3, and this basically just enhanced differentiation and mineralization of the bone. And both of this also leads to reduce the risk of osteoporosis, rickets, and bone diseases specifically. So if you're deficient in vitamin D, you will have these diseases specifically, especially in older people. It's very prevalent.
And as you can see in this picture over here, there's the normal bone matrix, and then versus to osteoporosis, you can see it's a lot more opened up, not as close together because the bone isn't as dense because there's not a lot of calcium in it, so it's not as strong, so it will break easier. You'll have a lot more fractures and things like that. And as she said, as you're older, if you fall, that's why people's hips break so easily. So this is an interesting thing. So they talk about lowering hypertension, actually lowering blood pressure, and in turn, like having better cardiovascular health. The big reason for this is because there's nitric oxide that is actually released by your endothelial cells. That's a reaction from the UVA rays from the sun. So just to make everyone aware, if you're hypertensive, you have a blood pressure that's 140/90 or higher. And basically nitric oxide is a new kind of substance that has been recently studied, that it's released by your endothelial cells, and it basically causes your smooth muscle to vasodilate, which is going to open up your smooth muscle, make blood flow easier, lower your blood pressure, all those things. So basically, after doses of ultraviolet radiation, they've seen an increase in this nitric oxide. This is a study that's done. They exposed people to different radiations of sunlight and then saw what the outcomes were, and found that the more radiation, the more nitric oxide that was produced. As I said before, UVA light was the one that had the highest effects, and they think it's because of the nitrite stores. So basically, the nitrite stores react to a certain wavelengths and absorbance. So it has at the wavelengths that the nitrite stores are absorbed is actually similar to the same wavelengths that the UVA rays are. So basically what happens is when the UVA rays come in, they like stimulate the nitrite stores, and that takes in the energy and will end up releasing the nitric oxide from the body, and this will lower your blood pressure. And then as you can see in this graph over here, they did a study where they had different situations, but they basically looked at UVA versus UVB rays and see how the nitrite stores and the amount of nitric oxide that was present. And as you can see, the UVA rays had the way higher than the UVB, showing that that the nitric oxide was released at this particular wavelength.
So the next thing we'll talk about is type 2 diabetes. So there are a lot of studies that I looked at specifically talked about how low levels of vitamin D or vitamin D deficiency is directly related to type 2 diabetes. And type 2 diabetes specifically is the formation of a deficiency in insulin production and a decreased insulin sensitivity. So having a vitamin D deficiency reduces both of these. Specifically in insulin secretion, there's a vitamin D receptor and a 1-alpha hydroxylase enzyme. And this enzyme converts vitamin D into its active form. And basically when there is a deficiency in vitamin C, the glucose-induced insulin secretion is reduced. And specifically in insulin sensitivity, there's also the same vitamin D receptor. If it is not present, it will reduce the insulin-induced glucose transport as well. So as you can see in this picture, this is a normal pancreas producing normal amounts of insulin, and the receptors are receiving that there is glucose in the body and they're taking it into the cells. But in someone that is diabetic, specifically type 2 diabetes, there is a reduced production in insulin, but there is a more high accumulation of glucose in the blood. But because there isn't enough production of insulin, therefore there's a decreased insulin sensitivity, so there's not going to be as much glucose taken into the body, but there'll be just more accumulation in the bloodstream. So all in all, if someone is vitamin D deficient, they have an increased risk of having type 2 diabetes.
So as you can see, between just like the hypertension, lowering the blood pressure, and the type 2 diabetes fix that it has, the sun can have a great effect on like your weight and obesity and your cardiovascular health. So these two things kind of go in turn with actually like improving your lifespan and well-being just by being in the sun longer and getting more vitamin D. So cognitive functioning was actually something that was more recently studied. Basically, to sum up some of the studies they found was that overall they found that with increased vitamin D levels, there has been increased cognitive functioning. So there's been a couple different studies that looked at it different ways. So something that's interesting, that the active form has a short half-life, but obviously cognitive functioning is more of a prolonged process. But despite this, they've actually found a correlation between the two. So what they think the reason is for this is that there's a linkage between vitamin D and your nervous system. So what they think is that vitamin D actually helps with the process of creating brain cells. So if there's more vitamin D, there's more an efficient and productive process when making brain cells. So the brain cells are more efficient, the brain cells are made better, along with other tissues in your body. A little fact is that only 64% of Americans have, or 64% of Americans do not have the adequate amount of vitamin D to promote like the optimal functioning of your tissue. So if everyone had the optimal amount of vitamin D, their whole body would be functioning better, and in turn your cognitive functioning. So the first study that was done in 2018. So they basically had 3 different groups. One group was exposed to the sun in the morning when it wasn't as intense, in the afternoon, and then later in the day when it was at its peak. And these are, keep in mind, these are more older people, because they looked at Alzheimer's and dementia and things like that. So there obviously could be other factors impacting this, but this study specifically looked at vitamin D levels. And what they ended up finding after they measured vitamin D in the beginning, took a cognitive test to see how they were with their memory and their just basic functioning of that, with that stuff. So they had the baselines for everything. They actually found that the people who spent the longest amount of time in the sun with the highest amount of vitamin D levels actually had the highest cognitive function and improved their cognitive functioning when they had lower vitamin D levels. Another study that was done was actually people with HIV, so they looked at HIV patients, a very similar thing, but they looked at correlations and links between lower levels of vitamin D, and they found people with lower vitamin D levels actually had lower cognitive functioning.
So next is seasonal depression, which can also be called seasonal affective disorder. So on this picture, seasonal affective disorder, SAD, ironically, is a type of depression that comes and goes with the seasons, typically starting in the late fall and early winter and going away during the spring and summer. Depressive episodes linked to the summer can occur but are less common than winter episodes of SAD. So this just basically is saying that a bunch of studies looked at that depression is linked directly to being less active, therefore you are less likely to go out into the sun, which can lead to being vitamin D deficient. And another study looked at that people that are specifically are depressed, when they are given medications, they are given anti-inflammatory medications, and vitamin D naturally, when you have the right amount of levels in your body, provide this anti-inflammatory effect. Therefore, this will decrease your likelihood of having depression. So basically just being exposed to the sun will lead to being less depressed, or will decrease the incidence of the seasonal affective disorder specifically.
So now we're going to touch on the disadvantages of the sun, as I'm sure everyone's heard of these things, but we're going to go into them a little more depth. So skin cancer, skin damage, like sunburn, early aging, and wrinkling due to the sun. And then also we're going to talk a little bit about eye damage. So firstly, we're going to talk about skin cancer, because that's probably the main one that everyone knows about. So there's like somewhat a little process of how skin cancer is actually developed in people. A little fun fact before that is that the second most commonly diagnosed cancer in people aged 15 to 29, so people in our age group or adolescents, is actually skin cancer. I'm going to touch on why that is a little bit later, but just a little intro there. So basically what happens is the UVB rays penetrate the basal layer of the epidermis, so these are going deeper into your skin. And what happens with the excessive exposure, the DNA nucleotide extension repair process is being altered. So the process of fixing basically damaged DNA is being altered. So the part that's being cut off and fixed, that whole section gets interrupted with excessive UVA radiation or UVB radiation. So then what happens with this, the repairing can't keep up because the sun keeps damaging it. and then it sends out bad messages and bad signals from the DNA to your cells. So what's happening, your cells are mutating, and it's also causing like excessive growth, which will cause a tumor. So you can see in this picture right here, it's just like a little more of a visual. So you see a UV rays, it's going to go to your skin, your DNA is being infected, and then you're having all missignaling here, and then it's going to cause basically progression into your skin cancer after over time of excessive cell growth. And then on this picture over here, it's just a little image. You can see that in the dermis, that there is the melanin there, the dermis here, and then you can see the abnormal area where there's been excessive buildup, and then that's where you're going to get your sign and symptom for skin cancer. So signs and symptoms, I went with just showing pictures here because it's a little more easier to see. So basically, there's not like, you don't really get a cough or sick or something like that. It's mostly something that's on your skin that you can see. So when people actually diagnose skin cancer, specifically melanoma, they do the ABCDEs of diagnosing it. So you have asymmetry, the border, color, diameter, and the evolving of it. So basically you can see here, if you look at the two different pictures, this one's symmetrical, circle, very like, clear to see. This one's more distorted. The border here is very defined, you can see it, but here it's more all over the place, so it isn't like a clear drawing. Color, the color should be like a normal mole color. If you ever had a mole, it's like a purpley light pink color. But this one is multiple colors, it isn't like unified. Diameter, if it's not cancerous, it should be smaller than 1/4 of an inch, but if it is, it might be greater. And then evolving, this is just like, if you have a mole or something that's changing and changing shape and changing size, and like that's something to look into. Also, you have 3 different kind of basic types of skin cancer you can get. All are a little bit different. As you can see up here, we have the different pictures of them, with the top one being the basal cell cancer. So that one's like, you get a shiny bump, it's pink. That one's the most common that you see in people. It's non-lethal, very uncommon for it to spread through the body. Then you have squamous cell sarcoma. That one's white, waxy, sometimes it's scaly, but the biggest determinant of that one is usually open sores and it bleeds. And then melanoma is kind of the more serious one that you see, but it's large, multicolored, usually dark, different size and shape, as it'll follow like this pattern right here. And then treatment, basic treatment for this is as you would kind of expect. So basically with the different cancer cell types, there's different ways to treat it. So the squamous cell and the melanoma, that's like what you would think, like radiation, medication, chemotherapy, surgical removal, all those things. And then the basal cell, that one's more rare for this one to spread, as I said before, but you can just use a cream or get it surgically removed with that one. And then obviously your normal preventive measures that I'll touch on a little later, but sunscreen, limit time in the sun, clothing, check your skin regularly. Don't just go out on the weekends and fry your skin and stay in all week. You need to like build up your skin so it's not just getting like fried every time you go out. And then hat, sunglasses, sit in the shade. So just be monitoring how much you're spending in the sun.
So next is skin damage. So skin damage, we talked about before, could be ranging from aging, wrinkling, sunburn, and even tissue inflammation, which comes from sunburn specifically. So skin aging can be basically go on the places most exposed to the body. So like your face, your neck, your forearms, the back of your hands, the places that are usually exposed because you're not wearing like things all over your face 24 hours of the day. This is usually due to radiation from the sun, which causes the aging phenotypes. And this also increases with time. So basically, as you increase your sun exposure, it just increases the aging of your phenotypes, which can lead to wrinkling and also decreased function of your 2 main functions of your skin, which are a barrier and thermoregulation. So as we talked about in class, as people get older, their thermoregulation decreases. What this is correlated specifically with sun exposure as well. So this can also speed up your aging of your skin, why you see a lot of people that are exposed, that are a lot tanner, have a lot more wrinkly skin as they get older, just due to this specifically. And also, skin aging is specifically linked to pigmentation of the skin, which is due to melanin, which Paige touched on a little bit, which is a group of natural pigments that add color to your skin and your hair. and this is produced from melanocytes. So what happens is the melanin pigments are produced due to UV radiation. So as you get older, there is a loss in production of the melanin producing melanocytes, which is why there is pigmentation in your skin, which can also lead, probably is one of the reasons why that it's leading to skin cancer as well. And also another thing is sunburn. So skin erythema is the formal name, which is the reddening of the skin, which is just caused from your skin being imposed and getting damaged with tissue inflammation.
So we're both going to touch on eye damage a little bit. So for the first section, you can get melanoma of the eye. This is like really rare, but it can occur. So basically also, as you can probably assume, so people with lighter eyes, blue eyes, gray eyes, lighter green eyes, lighter skin, lighter hair, tend to be affected by the sun more. For the eyes purpose, it's a little easier for the light to get through and affect and damage it. Cataracts are also something that can happen from excessive sun exposure. If you're not protecting your eyes with proper sunglasses or wearing really bad sunglasses and trying to look at the sun, you can get really bad damage to your eyes later on in life. So basically cataracts is clouding the lens or eye, or is transparent membrane, which actually causes an obstruction of light, so you have a harder time to see. And if you see anyone with a cataract, sometimes they have like almost like a cloud in their eye. And you also notice a lot of older people have cataracts due to the prolonged sun exposure over a long period of time that ends up developing.
And so the next one is age-related macular degeneration, which are basically deposits in the retina, which is the most important part to basically see and for your vision to equate. And so it's a little bit less common, but it's progressively forming. So as you increase your sun exposure, this deposit can continue to form, and it is characterized by bleeding and fluid leakage under the retina. And this is one of the most common causes of blindness. And the next one is pterygium, which is a fibrovascular growth of the conjunctiva, commonly encroaching onto the cornea. So this is basically, if you have a higher risk of developing this with a longer exposure to the sun and solar radiant energy. And in this picture specifically, you can see, as Paige talked about cataracts, you can see a normal lens, there's no clouding anywhere within the eye specifically. And in this one, you can see that it's a little bit fuzzy and cloudy in here. And you can even see when you look at the person's eye that it's a little bit cloudier and it's not as clear.
So we're just going to touch a little bit on sun damage prevention. These are the basic things I'm sure everyone hears about, but apparently a lot of people don't follow these rules. Sunscreen is important to protect against UV rays that the sun emits. Obviously, it doesn't protect from every single little bit, but it does help a great amount, so you're supposed to reapply. Wash when you go in the water, reapply, make sure you're not sitting on the sun with nothing on. In a study, they found that 44% of young Australians actually don't wear sunscreen at all, and Australia is a place where the sun is very strong and you can get a lot of quick skin damage there because of that. Also, they noted that 84.2% of people who don't wear sunblock accredit just forgetting it to put it on be the reason. Protective clothing such as hats, sunglasses, as we previously talked about eyes, it can be severe eye damage if you're not wearing good sunglasses or even sunglasses in general, and then shirts and stuff like that. And they also found that 20% of young Australians don't wear any protective clothing, so these can be some of the reasons why that skin cancer is the second most common diagnosed cancer in people between 15 to 29. Also, a big thing, limit time in the sun. So you probably shouldn't be sitting out in the sun in the hottest part of the day just roasting your skin, because that could lead to some of the disadvantages we talked about earlier. There needs to be an improvement of public health campaigns, as seen in some of the other studies that I just talked about. A lot of people don't realize the importance of wearing sunscreen and protecting your skin, because I think there isn't enough campaigns out there where people are seeing it. People are forgetting to put on their sunscreen. There probably needs to be more public health campaigns to inform people on the long-term effects that the sun can have on you. And then also just realize that dietary vitamin D, so supplementation, fish, mushrooms, things like that can help your overall health. Obviously the sun is probably the best way to get your vitamin D, but vitamin D supplements is also a good way to get some of those benefits that we've previously talked about.
So all in all, as you can tell, there's a lot of good and bad consequences that come with sun exposure. You can't really say that one outweighs the other because there is a lot of good benefits like decreasing depression, decreasing obesity and type 2 diabetes, but also the bad effects are like skin cancer, sunburn, aging of your skin, and also just melanoma in your eye or other issues that you could have. Basically just doing protective measures like Paige talked about, like wearing protective clothing and sunscreen, and just doing like interim sun exposure instead of just going out all at once and crisping yourself. And vitamin D is also a major component of why people need the sun, so you do need to go into the sun just to make sure you get the health benefits like with bone formation and other things. So there are a lot of good and bad things that come with it as well.
Yeah, so there just needs to be a greater awareness of what the sun can do to you, but also how you can prevent those measures and get the benefits from the sun, because it's really important to spend time in the sun, because if you're not and then you're going out there and going on the weekend to get a tan, then you're probably not doing yourselves any favors for the future. And the sun can be your friend if you take the right measures to make it your friend. So the sun is important.
And these are our extensive sources.
The end.